representing.
I just hit go live. I'll let you know when we are up. All right. Well, we might have dogs. We might have my cats.
We might have children.
Hey, anything goes here. The Chris and Katie show.
It's all free. All right, Chris. Music?
Are we live right now?
Mm-hmm.
See, this is my favorite part. It's the pre-show. All right, let's see if you, if our special guest can identify this song.
One of my favorites. Definitely Evidence Trust.
I like when it kicks in.
My dad used to like that song when I would make him listen to my music in the car, actually. But it's very motivating when you're running up a hill.
That's awesome. Thanks, Chris. DJ Chris. Hello, everyone. We are happy you're tuning in today. We've got special guest Dr. Dan Weingold from OrthoVirginia. We've got to shout out OrthoVirginia for being one of our incredible sponsors this year. And so we're super, thank you, ASA parent. What'd you say, Chris?
Representing.
Oh yeah, we're all in our badges today. We've been chatting a bit pre-show here, and Dr. Weingold has some really great info for us today. All kinds of things for kids of all ages about staying healthy right now, staying injury-free, what to do if you have an injury. He probably has more of an agenda for this than we even do. But first of all, how we all feeling? Let's do our Tuesday check-in. Chris, how we doing?
You know, hanging in there. Things are on the up, and I am just happy to be here. You know, I really do like this time that we get together, Katie, and then obviously we get our guest in each week. We have a lot of fun, so it's been something that's very exciting during this crazy time. So enjoying being here.
Absolutely. Same.
Yeah, I worked today. I worked a.m. to about 2 p.m., but I'd work again.
What kind of yard work?
Oh, well, there's raking, there's cleaning up all the debris, there's planting, there's weeding, there's mulching, there's rearranging plants that look better in other places.
I think maybe set up our own show, Dr. Weingold, at another time, just to talk through the different yard work we got going. I'm right there with you.
We'll do an encore, how to, plant a garden, mulch your yard. Mm-hmm. That's perfect.
Different muscles.
Yeah, Chris is putting in a garden out back. How's your garden going?
To be fair, it is physically more than I thought. Doing the yard work. There's a lot of I'm feeling it in a lot of places that I haven't felt things in a while. So maybe I can get some nuggets from you today.
Wait till you turn 55. You'll feel it for days.
All right. Well, let's start out with maybe tell us, a little bit about yourself, what you do in your day-to-day, how you relate to, our soccer players, and we'll go from there.
So I'm an orthopedic surgeon with OrthoVirginia, and so I started out as a kid loving sports, playing sports, following sports, and I played soccer at a very young age. It's actually very funny that I look at this. I'm looking on my desk in my office, and I this was not intended to be up, but I just saw this. I'll show it to you. This is when I was 6 years old, Camp Robin Hood.
Oh my!
Award of merit. I was 6, and it has on there soccer. Because back then, up in New England and New Hampshire, there wasn't that much soccer being played, but I just fell in love with soccer, and I was fast, and I liked to kick the ball. So I played soccer at a really young age, and so forth. And then my kids have all played and still play soccer. So my sort of desire to help with Alexandria is because of the sport that I wish I could still play as well as I, wanted to play when I was younger. But as an orthopedic surgeon, so, we're charged with caring for sort of diagnosing and treating and preventing people who have muscular and skeletal injuries. So sore muscles, ligaments, tendons, bones, you name it. And a lot of that falls into sports. We take care of people who have more wear and tear, older age problems, and overuse injuries, but a lot of sports injuries. And that's one of the things that I love to do is take care of sports injuries, including shoulder and knee problems. And we see an awful lot of knee injuries in soccer players, girls especially. So, um, my training is such that I was undergrad at the hated Duke University, and I went to Maryland for med school, and I trained at GW for all my ortho. I know your last guest is a soccer coach down there at GW.
Yeah.
And then I've been practicing in real practice since 1996, so about 25 years.
That's awesome.
That means he's actually tuning in, so I know we have at least one person watching.
Oh yeah, now it's prepping.
Just one question I had, just going back to your playing days. I heard you mention just about all your family except your wife. I wanted to ask who's better 1v1, you or your wife?
Well, she was like me. She was more of a defensive player, so we really just want to see who could take the ball away from the other person. So nobody really goes for it. But I'm still a lot faster.
Now she played, right?
She played. She was all-state in Connecticut, and then was scholarship player at Vanderbilt.
Wow.
And so forth.
She's the next guest.
I was really focused on pre-med, so I didn't want to go play college soccer. I had more serious aspirations. But I played for Landon here in Bethesda, Landon School, which is a very good team. Even back then, a very good team. I had a great competition playing DeMatha and Gonzaga and Sidwell Friends and Bullis. So it was great fun.
That's awesome.
That was enough.
So I like that you just mentioned high schools in the area. Those are definitely high schools that some of our kids attend. So we have been talking, and a lot of our coaches have been sending all age kids activities to do while they're at home right now. So we and our coaches are mostly focused on sending soccer skills and drills. What else should kids be doing before or after or during their soccer training here on their own to make sure they're staying safe and injury free?
So I thought about this for a little while before we got on, so I made some notes, and I came up with some sort of general guidelines for staying healthy as well as staying fit. Mm-hmm. And you'll see that they all sort of intertwine with each other. So I came up with sort of 4 areas.
Awesome.
One would be diet. One would be fitness. Mm-hmm. One would be sort of routines, and the other would be sleep. And all of these sort of things will mesh a little bit. So if you will let me talk for a little bit, then I can kind of go through that and just stop me when you have questions.
Yeah.
But then, separately from all that, the disclaimer, of course, about the coronavirus is hopefully everybody's still paying attention. Even though your athletes are probably the healthiest people in the world right now.
Yeah.
And at lower risk, but hopefully people are still paying attention to the basics of stuff, such as being careful about the distancing, wearing bandanas or masks when they're outside, trying to avoid contact sports, frequent washing, avoid touching your face, even being careful about being around pets. We're finding animals are also getting sick, zoo animals and things like that, so being careful about that. Just all the basic sort of guidelines about distancing and being safe. But in terms of, for example, diet, one of the hardest things I think I can convince my kids is that breakfast actually matters. That breakfast is probably the most important meal of the day, but not too many people eat it, or at least that I can find in my family, besides my wife and I. But your tank is empty when you wake up, and you need to fill your tank up to get through the day. And so breakfast is key. And if you don't like your big breakfast, what better way to stay healthy is to make some smoothies. Add a bunch of fruit and vegetables that will give you your calcium, your vitamin D, antioxidants, healthy food, tastes good, it's not filling. Mm-hmm. And avoid right now, when there's probably going to be a little bit more of a sedentary style, avoid all the junk. Avoid the carbonated drinks, caffeinated drinks if they drink that, junk food, sugars, and so forth, and just sort of being aware that if you are getting outside, great. If you're not getting enough sunlight, to make sure you're getting enough vitamin D and calcium in your diet, because your bones need that. Your bones are your bones stay strong, and you have less bony injuries that way. And so lots of food sources you can get that have calcium and vitamin D.
That's good.
And then, from a standpoint of fitness, they always recommend, at least for adults, kids too, 30 to 40 minutes of some sort of cardio exercise at least 3 or 4 days a week. Mm-hmm. And, obviously you can get cardio playing soccer, but if you're not playing soccer, there's got to be other ways. So there's always walking, dog walking. There's jogging. There's bike riding, which I think a lot of people are doing right now. And there's all these indoor and outdoor workouts. In the old days we had the Wii Fit, but there's plenty of online things. I think doesn't Ryan, do a Facebook,
Yeah,
workout?
Ryan's
And
got
then
a
all
workout
kinds of
going.
great, cheap, free ways you can stay fit indoors and outdoors and stay apart from each other while you're doing that. So something that sort of maintains, if not every day, every other day, doing something cardio wise, right? That doesn't have to be intense; it just has to be consistent. Um, I'd be careful about weights if you haven't lifted weights before, especially if you're a growing person. I worry about back injury, I worry about growth plate injury and overuse injuries. So maybe weight training under the supervision of a parent or someone who does that rather than picking it up on your own, but not necessarily avoiding it entirely. And then daily stretching. Kids are still growing, and so you have more time now. So why not stretch? Stretch your back, stretch your hamstrings, stretch your ankle, Achilles tendons, stretch your patellar tendons, all the things that these kids get, that we get overuse injuries and get pain. If you're sitting around all day, you're going to get stiffer. And so it matters. Even if you're not going to exercise, it would make really good sense to stretch in the morning and stretch in the evening. Wait till you get to your mind. And then, you guys know the soccer stuff. I don't really know it, but the things that I thought of that we used to do with the kids in the front lawn in the backyard is, if you're not a good juggler, now is the best time in the world to become a good juggler. 6 feet apart, 8 feet apart, heading drills. Kick the tennis ball or a small ball against the garage. See how many times you can do one touches. If you got a goal in the backyard, hit with every side of your foot, both feet. Just little things like that for soccer skills. And then when I talk about routines, I think about two things. I think about not really making drastic changes right now in your sleeping and your eating habits, but at the same time trying things you don't normally do or had time to do during the school year when you're busy, when you have soccer 3 nights a week, when you got school. And there are some things you can do that are physically helpful and things you can do that are mentally helpful. So physically helpful, help your parents do the yard work, digging with a shovel, planting bushes, chopping up stuff, mulching. This is physical work, and it's work that's tiring and muscles you don't use, but it's helpful, and you interact with people that you might not normally want to spend as much time with, but it's building. Right. Things in our day we sort of had to do. It wasn't an option, but at the same time, sort of take advantage of the time. We talked about ways to prevent injury. Well, fix those holes in your backyard. If they're empty holes you could roll your ankle in, fix them. Learn how to sod, learn how to graft. Use this wonderful tool, YouTube. Go online, learn how to play a musical instrument. They're free classes. Learn how to play the guitar. Fill your schedule up with other things to keep your mind off the fact that you're not in school and playing soccer, and keep your mind off playing computer games all day long. And so things that come to me like that, I'm trying to get the kids to look at. Even possibly learning skills that you may need in college, like how to do laundry, wash cars, go on Maryland Public Television, fantastic cooking show, learn how to cook, all these little things like that. In other words, the focus is not just also physical, but mental health. Nikon has free photography classes online this month. Beautiful time in the time of year to take pictures. And then sleep. Sleep is a big issue for kids, and they still need their 8 hours. But what I'm finding now is they're up later, they're more, they're playing games more, and their patterns are changing. They're getting up later, and I think that's not so healthy for them in general, because then it changes their eating habits and their activity levels. So my advice to every kid would be to unplug an hour before bedtime and read a book or read a series of books and kind of shut your mind down, quiet it down time, instead of staying plugged in, because that's kind of the thing I'm seeing a little bit more. As far as sort of how to stay injury free, in addition to stretching, cross training, I think you alluded to the fact that some kids play more than one team, but I think they should play more than one sport, because we see less injuries in kids who play more than one sport. That's not always appealing to certain coaches and so forth, but best example will be the guy who got hurt at Alabama, Tua. I mean, the reason why he was such a phenomenal football player as a quarterback is because he was also a point guard. So he never traveled. He always just played, great ball skills. So that kind of stuff, I think, makes a lot of sense to me as well. And obviously, they're not playing contact sports right now or organized sports, but there's still the option to start picking up some other things temporarily.
Yeah, that was awesome. I took notes, but you can't see them. I wrote down your 4 things because I want to definitely put that in the show notes. So interesting, important. And one of the points I really liked was utilizing this time for something other that you don't usually get to do. I actually talked to my U13 team recently, and a lot of them told me about different outdoor activities that they're getting to do, like rollerblading or biking, that they don't spend as much time doing. So I thought that was an interesting sort of silver lining of this experience, and something that I want to remember to continue to recommend too.
Yeah.
Yeah, on that, I just had a question on that too. I agree that super interesting too, right? Like sort of doing other things you wouldn't normally do, and sort of taking your mind off of your normal routine as well.
Mm-hmm.
How does it impact or correlate into injury prevention? Do you find that because you sort of take your mind off of certain things, that it then correlates to the physical, like to your physical body in terms of preventing injuries?
I mean, I think, I think in a way, yes and no, but yes more than no. I think people who are more diversely involved, I think in general just have a more positive outlook, and I think people who have a more positive outlook are more likely going to be more generally. And it's kind of philosophical, but it's sort of true. And so in that regard, I think you have your head more about you, if you will, more willing to share, more willing to communicate, and so forth. So in that regard, I think it helps. I also think that, as I said, if you don't just focus on one thing and you focus on more than one thing, I think you are a little bit less prone to injury, whether it's just one sport like soccer or so forth. And so I think that's been borne out in lots of different places. And even kids in school who play sports do better than kids who don't.
Yeah.
So in most cases. So
so if hopefully nobody's injuring themselves right now or, working out at home, but, there are kids with prior injuries, and I know you're still treating patients maybe differently than you have in the past. So tell us a little bit about maybe options kids have right now and how you've sort of pivoted the way you're providing treatment.
Right. So what we at OrthoVirginia are trying to do is we're open and we're available for the community for treatment, and we're doing it in two ways. If you've had an injury, you're clearly something's wrong. You injured yourself and you're not walking well. It's really uncomfortable. It's there's something different about your routine. Whether you heard something, you felt something, or it clearly just doesn't look and feel right, and it seems like there's an urgent or a semi-urgent problem that requires a visit, you can come see us. We're open. We're staffed every day from Monday through Saturday from 8 a.m. to 8 p.m. And we're available for injuries and more urgent stuff. And the purpose for that is to take care of people who need to be treated and keep you away from the hospital, keep you away from the emergency room. Don't go to the emergency room when you can come up to see us, because we'll be able to do the assessment to keep you in a safer environment. We're being careful. We're not doing regular schedules. So instead of seeing 40 patients a day, I'm seeing 12 or 15. They're all spread out. We're screening everybody to make sure they're safe to come in. And then they come in, they get their evaluation. If they have an x-ray, they need an x-ray. And then we make a plan and we get them out. So it's trying to keep the hospitals safe and take the brunt of the people who go to the ER that should come up to us instead.
Yeah.
And for those patients who may not necessarily have something urgent or immediate, but are dealing with an ongoing issue, we're all offering, most of us are telemedicine, just like you and I are doing right here. If you are a patient or want to become a patient, all you have to do is call the practice and they'll assign you a chart called a MyChart. And once you download your MyChart in the Zoom app, we can have an appointment just like this. And I can see you, we can talk about your problem. If I think you need to come in, you come in subsequent to that. If I don't, if I think you might need some treatment, I can recommend treatment for a while and see how you respond. If I sent you for an MRI, I can show you your MRI review, your images, your pictures, and we can take care of you remotely while we're waiting for this thing to go away.
Well, let's set one up. Back. I got my shoulder going.
They're only 20-minute appointments, Chris.
You need to block out about an hour.
Can you talk a little bit more though about like the steps that you take after that initial sort of conversation? Because I find that coaching wise, you'll have kids that have these sort of nagging injuries, and as a coach, right, I'm not a trained profession in the medical field or anything like that. It can be challenging to provide anything but ice or something like that, or just rest. So what's sort of the process after you had that initial discussion with, like, say one of our kids set that up with you? Is there an action plan for them to follow steps like the next couple weeks or something like that to try to help minimize the pain or the injury that they have?
Well, sure. First, if they've had an injury, I would have to determine if they would have to come in and actually have me do a hands-on exam with or without an X-ray, depending on the kind of injury that it was. And then from there, I could sort of get an idea if this was just an overuse, sort of a strain, pulled something. In which case, the principles are always, rest briefly, right after injury, usually icing, switching to heat, sometimes some anti-inflammatory medications for brief stretches, and then rehab stretching. And stretching, we can sometimes have you do stretching and strengthening on your own with a trainer, or we'll send you to a physical therapist. And if I think it's just one of those things that just needs to heal on its own, which is hard for athletes who always want to get back out there, I can give them a guideline. Is this going to be a 1 week, 2 week, or a 6 week, pulled hamstring? If they've had an injury that I need to follow, then I'm going to have them come back in, or maybe remotely talk to them about it. But if I feel I need to examine them, I'll examine them again before I can either feel comfortable clearing them or not. Because some injuries, as you know, on the soccer field need diagnostic testing, such as an MRI scan. So it will vary depending on what we're treating, a strain, sprain, overuse, or a true injury that needs more immediate care.
Yeah. On that note, that sort of reminded me, and maybe to loop back to having a little more time maybe for other things. So maybe if you could talk about some of the injuries you see often in high school players specifically. I mean, you mentioned knees for high school girls. Is there anything stretching, as you mentioned, anything like that now that they have a little bit of time could be good to work into a routine of that, maybe that, they keep up when we return to normal life, whatever that is?
Absolutely. And girls more than boys that tend to be a little bit more potentially prone to ACL injuries. That's always the big fear, and so forth. There are some theories about that, whether they're quad dominant or not. If their quadriceps and their hamstrings aren't balanced, then figuring out which muscle group needs to catch up and focusing on strengthening if it's the hamstrings or the quads. Always improving flexibility for anyone who just has that prone tendency to always pull stuff or feel tight. And then girls, especially, if you guys don't do this, would be, even teaching them the simple basics of how to land, from a jump, how to position their legs if they're practicing drills to avoid getting caught. For a lot of the kids, especially girls, not to single them out, but sometimes the way they're taught how to land or just how they learn how to land from a jump is not necessarily the best way to do it. So, for example, I don't know how well you can see me. A lot of times we find that when you're jumping and you're landing and your legs are out straight, you have more of a tendency to hyperextend or get caught and twist your leg. Whereas if you're landing kind of down low like that with your knees flexed, then you're balanced and you're more protected. So in some respects, it's just getting that message out. But I would also say that, people who have back issues, I think every morning and every evening after getting up and before bed, they should be on the floor, knees to chest, back stretching, core strengthening, and so forth. And there are many ways to get those exercises, either forwarded to them off, exercise programs from our office. I print out a lot of patient education materials for people to do home exercise, especially now. And I think it just goes back to the point of, if they're not as active as they normally are, which I doubt they are, they need to at least do something every day where they're stretching every day, and then getting up, even if it's a bicycle or a stationary bike, because you get joint motion and strengthening at the same time when you're biking, which is what we tell all of our patients who have bad knees anyways, don't run anymore.
Well, speaking of the running piece, I will say that a lot of our kids, I would say between U13 and up, are spending more time running right now.
Right.
And that could be on concrete or whatever surface it may be. But I mean, what sort of recommendations do you have for those players who are trying to take initiative to stay fit and they use running as a way to do that? Or what are some tips that you have to sort of prevent and minimize injuries that could occur from that?
So a couple of points. One is make sure you're not wearing old running shoes. That's the most important thing right off the bat. I cannot tell you how many people come in with sudden onset of pain in their feet, their legs, their knees. And I ask them how much they've been running, and they tell me how much. And I asked them the last time they switched the running shoes, and like probably been a year or two. But I hear that's good. And it's not the years, it's not the months, it's the miles. Once you exceed about 350 miles per pair on a given pair of running shoes, it's time to ditch them because they're not helping, they're only hurting. So one thing is that proper shoe wear, make sure that they fit well, that they fit you well, that you didn't buy them on your own without having that assessment if you want to be a regular runner. I think, certainly stretching your Achilles tendons and stretching your quads if you're at all a stiff person. Flexible people hate stretching before running, but if you're prone to stiffness and tightness, you should do that before you run.
Yeah.
Focusing on sprinting rather than just distance. There's plenty of programs you can look up, interval training where you're sprinting, resting, sprinting, resting. A lot of people feel that's actually healthier for you than just long distance running. Doing some core strengthening. I'm sure you know about planks and dead bugs and, the abdominal exercise, strengthening your core. You need a foundation. So those are the things that I would think of. Yes, I'm sitting from the waist up. You can't see my.
This is awesome. Go ahead, Chris.
No, I was just going to say that's super helpful and great advice. I mean, again, like I know right now some of my U15 players are running way more than they usually do, just going out and run 2 or 3 miles or whatever it is. So that's, just having the correct shoes at a bare minimum is something that can help out a lot. And just looking up those resources online for proper stretching, it sounds like it's helpful.
Yeah. So once we return to play, sooner rather than later, is there anything that us as coaches should look out for as, we're going to go from, in theory, perhaps not a lot of structured activity to 3 practices a week more if they jump into summer camps? Precautions, extra stretching, what kind of things should we and the kids plan for?
Well, I assume you're doing it already, but if you're not, absolutely. When they get there and they're all kind of loitering and hanging around, that's when they should be stretching.
Yep.
If they're waiting for the next practice to end, first practice then before they're on, instead of sort of socializing, they should be stretching right away. They should stretch their heels, their Achilles, they should stretch their hamstrings, their quads, their backs. They really ought to do that. I would recommend doing that before every practice for at least 10 minutes, if not 15 minutes as a warm-up. And I guess I'd make sure they're ready cardio-wise. Monitor them for being fatigued, monitor them for being a little bit out of it, because if they're tired, they're not going to play as well or as safely when it comes time to contact either. So I think that would be the key, is to make sure their fitness is up to shape. And if it's not, it's perfectly reasonable to have them run for a while first before they practice, just loosen up, even if it's just a few laps around the Witter complex, just to get them ready. And then build back in gradually, as you know, which you don't do anyways. You guys don't usually go right into scrimmaging. You're doing practicing and passing drills. But I think that is the key, is to come back a little more gradually, so forth, and make sure they're staying well hydrated, because they're going to be coming from February, March, where they were normally used to playing, to much warmer weather, more humid, and you might start seeing more cramping and dehydration. So everybody ought to have a full tank of water.
Yeah, I hadn't even thought about that. They may come back. Chris, staying hydrated.
The freshman 15 hit early.
Oh man, this is so much good information.
It's so simple, just some water, and it makes sense, right? It's gonna be hot. Start hydrating early. Like, that to me is a great example of preventative work that an athlete can do now, so that they can prepare themselves for when the season starts. And it's getting a little bit of a competitive edge too. Everybody who's playing has a competitive nature to them. And when you're looking at, getting ahead of that, these are like small things that you can do that go a really long way.
Yeah. Chris, I was thinking about that too, with just the 4 things we talked about earlier: having a healthy diet, staying fit, keeping routines, and sleeping. If kids, use this time unwisely, and then think once we start back up that they're just going to hop back into it after sleeping in 4-hour spurts and talking on the phone throughout the night. Like, that's not going to cut it. So I love all those things, and we'll be sending those out kind of in the show notes. I think it's super important. As we wrap up here, anything else that you think would be important for us to share or you to share as we kind of navigate this interesting time?
Well, I mean, stay home right now.
Yeah.
It's still kind of, we haven't seen the really scary that's happening not that far away.
Mm-hmm.
So that's hard to get a teenager to stay home.
Yeah.
But it's really, I think, great advice to not go out a whole lot right now. And if you're going to go out, I just mean like go in your neighborhood. Don't go to the stores unnecessarily. Wear bandanas, you know. I feel like I'm the next cowboy when I go to the store, but
Nice.
that's how I go to the store, and I have gloves on. I look around, I'm like, this is like World War Z, so it's a little bit scary as a physician who knows how this could be. So for me right now, stay closer to home base, listen to your parents, stay in touch with your friends remotely more than everything. But yeah, do all these different things to keep your mind fresh so you don't get in a funk.
Yeah, that's important. I actually made some masks last night, so we're trying to take those precautions too.
You know,
Where
well, my wife was telling me that if you have the access to the BN network, the Spanish and the Premier Leagues are posting a lot of interesting shows right now as well, just to keep people interested in watching soccer.
Oh.
Because normally when they're on, she is glued to Barcelona. And so forth. So we've been watching a lot more soccer this year, but they're posting a lot of things right now that keep people interested. I love going back and watching old stuff. So I like watching New York Cosmos when they had Pele, and when I was watching soccer, Franz Beckenbauer and Pele and all those guys. But no, there's a lot of fun stuff you can keep your mind on.
Yeah, actually, that's a good shout. Before we let you go, who's your favorite soccer team?
My favorite soccer team is the U.S. Women's National Team, of course.
Oh, excellent answer. Mine too.
I mean, you got to go with the winner.
Got to. I know.
I hope the men get there because I do enjoy watching them, but I just love watching the women's team. I just love it. I wish like they could all play the same. I want to see all of them play. You know,
I know.
I like watching them play, and I want them all to win, but I also like seeing some of the new blood coming in. So, no, I think it's great fun. It's must watch TV when they're on.
I agree.
Agreed. The men got a long way to go.
Yeah, but I like what I've seen out of them. I just
yeah,
they don't get as much publicity right now, so they're not on as often.
Well, hopefully they are also adhering to some of your notes here in this time, because I think all of them both men and women could benefit from some of these tips. I should
say OrthoVirginia is, we are the team physicians for the DC United, so I got to say, I'm a United fan too.
Excellent. Very cool.
But my wife's favorite team is Barcelona. She's a big Messi fan.
Ah.
Great choice.
Yeah, so I guess I like them too.
At least you get to watch them. What'd you say, Chris?
It's incredible what Messi does, to be fair.
I love watching him when he has the ball, because it's almost obvious that his goal is to get around a couple of people whenever he can, but otherwise I love watching his passes. I love how he knows where the ball is going to go before it comes to him, and he already knows where it's going to go to get the next guy set up if he doesn't score himself. For me, that is the most beautiful thing of soccer, is his passing ability.
Yeah, and just on the
ability to do it.
Yeah.
The physical aspect too, I thought I saw a cool video, and this is totally sort of side note, but
love it.
As he was coming back from one of his latest injuries, they, I think it was Barcelona TV or something like that, showed him rehabbing. And I thought that was really cool to see, because usually we're seeing the end product on the field, but to see the amount of work that he was putting in to get his body back to where it was prior to his injury was pretty incredible. And I think that's key for some of our players to see, is that even the greatest player in the world, or arguably ever, the amount of extra time that he puts in behind the scenes to make sure that his body is up to par and healthy and ready to go, so that he can perform at that level think that was really cool to see. It was a neat video. And Katie, maybe we can like post it somehow if I can find it. But I thought
if you could find it.
Yeah.
I think he was rehabbing on a sand court.
Yeah, that's exactly what I'm talking about.
I saw that too. That's awesome.
Yeah, got to keep the body right.
That's true. He's short like me, so it's stay low to the ground.
All right. Well, thank you so much.
Yeah,
so many great tips. Thanks for helping keep us safe, healthy, fit. Good luck to you as you're treating patients during this time, and we hope to see you on the field soon.
Well, if not there playing, at least I'll be there watching. And, I guess you guys don't know when the adult soccer league is kicking in, or are you affiliated?
We don't know yet.
Yeah.
But, yeah.
I'm available for those folks. I expect I'll be seeing more of them.
Yes, probably. But hopefully not too many.
I don't know.
I mean, since we've had this conversation now, and maybe you can just come to my team's co-ed games and just follow.
I think my mind would think I could do things my body just doesn't have the ability to anymore. That's my problem. I'd be my own patient.
Team doc for Chris's dream team. That's what he needs.
Yeah. That's great stuff. Thank you so much.
You're welcome.
Chris, you want to take us out?
Yeah.
Some tunes?
Gosh, time just flies.
I know.
We're going to have to make these episodes longer or something. I mean, or maybe just up it as we get more and more followers.
I know.
Well, I put the word out to two of my friends who are parents of an ASA player, so hopefully they've listened to them.
Nice. Excellent.
They haven't sent me any Instagrams yet, so we're waiting.
Thanks, Doc. All right, here we go, Katie.
All right.
There you go.
There you go. There you go.
Old people can rock.